Good afternoon and welcome. I can see that lots of folks are joining us this afternoon for our first Mays Institute speaker series of the year. And everyone is excited, delighted, and honored to have our very first guest be one of our very own. Tiffany Benjamin needs no introduction to this community, but I will just say that she is the chair of our board of visitors here at the Lilly Family School. She wears many hats. She's also CEO of the Humana Foundation and leads one of the, I'd say, most significant efforts right now in the field of health equity. She's a champion for lifting up the voices of the underserved. She also serves as board chair for the Center on Disaster Philanthropy. And we have not only admired Tiffany's amazing leadership and work, but here in Central Indiana, we've also gotten to know her because prior to assuming the leadership role at Humana, she also served as CEO of the Eli Lilly and Company Foundation and was instrumental to the work that took place around Central Indiana and beyond around racial equity. So Tiffany, we're delighted, we're honored, we're thrilled really to welcome you to our speaker series today. And there are lots of questions. I shared that even before the series, we received some questions from our students, doctoral students and others, very specific questions around health equity. So I'm going to encourage everyone who's joining us today to send in your questions, your ideas, your comments throughout our conversation. And I'm now going to just turn it over to Tiffany with our very first question of today. First of all, thank you for joining us. We're delighted to have you. And tell us about your journey in philanthropy and specifically your interest in healthcare. I know that it comes from a very personal space, and you shared that with us here at the school and at the Mays Institute, but I'd love to introduce our audience to your background and your work. So Tiffany, welcome, and we'd love to hear about your journey in philanthropy and healthcare.
Yeah, thank you, Una, for being here. I'm really excited. I'm especially excited to support the Mays Institute, which I think does a phenomenal job of really telling us that philanthropy is for everyone and really making sure that everybody is expanding the vision of what a philanthropist is and also thinking about how to put diversity, equity, and inclusion and belonging into the space of philanthropy. So thrilled to support the Mays Institute today. When I talk about health equity, I'm probably going to talk a lot about strategy and vision today, but I want to be clear that this work for me is personal. Both the equity part and the health equity part is really personal. Equity for me and my family has really been a generational struggle and focus and commitment. So until I was 10 years old, I spent every summer with my great grandma, who I called Nana. Her name is Maddie Pearl. And every summer, I just thought she was the most brilliant, talented, amazing person I had ever met. She actually grew up in Ripley, Tennessee on a farm. Her parents were sharecroppers, and she could tell you stories about picking cotton when she was a child. And so when she was 16, with her husband, she moved north to Indiana in search of a better life. And ultimately, she and her husband were able to raise two brilliant, strong-willed, talented women, one of them who is my grandmother, and who 3 generations later ended up having a great-granddaughter who graduated from Harvard Law School and sits in front of you today. My great-grandma was brilliant, but she did not have the opportunity to go to school past elementary school because of barriers that were in place for her. And realistically, what that means is that I know firsthand how inequity can rob people of their potential and how opening doors for equity can provide an opportunity for people to live their dreams. And really, we all have the same dream, which is to have the best for our families. So I feel like equity is my story and it's my family's story. The question you asked me about how I got here, I am born and raised in West Lafayette, Indiana. I am not a Boilermaker. I want to be really clear about that. I am a Hoosier through and through, ride or die. And I attended IU to become a journalism major. I wanted to be a writer, expose truths, teach people and learn stories. And so IU was the perfect place to really learn that. Shout out to the media school, and to really grow. I eventually got really interested in policy and politics. And so I ultimately majored in journalism and political science. And I decided after my third year in college that I would take an internship in the Indiana State House. And all the other interns were looking at law school. And so I said, oh, I guess I should look at law school. It wasn't that thoughtful. I'm pretty honest about it. And so I had good grades, I got good scores, and I actually went to an advisor who was a third-year law student at Indiana University through my scholarship program. And I said, hey, I want to go to law school. Maybe, I don't know, can I do that? His name is Johnny Pryor, and I shout him out all of the time. He works at the Lilly Endowment these days, and he's an amazing person. And it was Johnny who told me, apply to Harvard, which I thought was insane because I thought only people on TV went to Harvard. I did not know that was a real thing. It just did not seem like reality. But lo and behold, always listen to Johnny Pryor as a life rule. He was right. And I went to Harvard to really try to figure out how to make a difference. And so I spent my first summer after the first year of law school at the Equal Justice Initiative of Alabama with Brian Stevenson. I spent my second summer at the Public Defender Service of Washington, D.C., and I thought I would do something in the criminal justice space. Ultimately, when I graduated, I decided to go to a law firm, frankly, because I thought I could learn more, and I don't lie to people to pay off some bills. And I stayed committed to law and service of community by doing white collar law, but also still doing death penalty cases and being a member of the board for a new juvenile justice nonprofit organization. So I stayed committed to community always. And then I decided I wanted to come back home to Indiana because I missed home and I had 2 kids and I wanted to be near the grandparents. So I joined Eli Lilly and Company as a lawyer and stayed community committed. I was the chair of the pro bono committee there and did a lot of things. And I think one of the side jobs I had, and one of my jobs was to be the corporate secretary for the Lilly Foundation. And so I decided that I would be the best corporate secretary for the Lilly Foundation I could possibly be. I went to the meetings, I learned a ton, I asked a ton of questions. And then when the head of the foundation decided to move on somewhere else, I said I was devastated he was leaving and that I wanted his job. So I became the head of the foundation at Lilly, which was a wonderful job where I got to think about global health and where I got to think about how I can make Indianapolis better. And I did that very shortly thereafter. COVID happened, the civil and racial unrest in our country happened. And so I saw an opportunity to really make a difference there. I took that work and decided that I would commit to community, my community, and seeing if I could make a difference. And I should have said that I spent a little bit of time on Capitol Hill before I moved back home. And I got to work on the Affordable Care Act and do those sorts of things. So I had this policy bent. And so last year I took over as the CEO of the Humana Foundation. And the reason I did that is personal too. It's about my commitment to healthcare, in particular US healthcare. And I really like that the foundation has a deep commitment to health equity and finding innovative approaches to barriers to health for marginalized communities and for communities of color. And why does that matter so much to me? So last year, my grandma, who I call Mimi, who just turned 90 and amazing, and she is brilliant. She graduated high school early, and she was one of the first Black graduates of Purdue University Northwest nursing program. She is a person who has centered herself in helping others and understanding healthcare delivery. And she passed that down to my mom, who started off as a telephone operator when that was a thing, but ultimately became a social worker. And my mom became a social worker as a single mom, and she took me with her to her internships and her classes, and I sat with her when she supported HIV/AIDS patients, when people wouldn't even say the word AIDS out loud. And I sat with her when she supported people in nursing homes and hospitals. And I really learned that connecting to and listening to people in their times of crisis and need is the most powerful tool you have to make a difference in your life, someone else's life, and society's life. And so while the science may have changed, hopefully, since my grandma became a nurse, and while the ways that we communicate may have changed since my mom became a social worker, health and healthcare and the US healthcare system is something I feel particularly connected to. And the fact that we have to center people first in healthcare work is something I feel very, very passionate about, which is why I'm so grateful to lead the Humana Foundation as we seek to address inequity and really look at it from the lens of health and healthcare.
Stephanie, that is amazing. I think the stories you shared right now, along with what you shared earlier with your mom as a social worker, taking you with her on site visits and learning the most important skill, which is the ability to listen and learn from others. Really listen, that deep listening that so many people have to work hard on. You learned firsthand before you even were in the field of philanthropy or even in law or any of the other roles you have played. So what I have taken away myself is that you have worn many hats, but they've all led you to this passion for equity and for communities and serving the underserved. So that gets us to the very next question. Everyone on this call, everyone who's joined the webinar today is actually quite interested in understanding health equity as the Humana Foundation sees it, how that concept is evolving. I say that because some organizations, foundations, other funders in philanthropy were working on health equity, but COVID has not only laid bare the extent of the disparities, healthcare disparities in this country, but also the barriers that so many communities face in accessing quality healthcare. So I want to just ask, what does health equity mean to you? And now that you are in this role, leading the Humana Foundation with a close tie to Humana Inc., you have a front row seat to helping the public understand what it means to live in a country where we still have significant disparities around access and who gets served, who isn't served, and communities of color especially face significant barriers. So I'd love to hear how that concept is evolving in your mind and what you're learning around health equity right now.
Yeah, so everybody on my team, including me, has these little laminated cards that we keep on our desk with definitions of terms. And health equity is the top term for us, right? So in its purest sense, health equity is the elimination of unjust, avoidable, and unnecessary barriers to health and healthcare. We're living in a country with the highest healthcare spending per capita, but we're near last in access, efficiency, outcomes, and equity. And the cost of those inequities are projected to triple over the next 2 decades as we have an aging population. So one of the reasons I took this role at Humana Foundation was to really elevate the focus on health equity, especially at this moment in time. And we've spent the last year really examining what does it mean to do health equity work and how can you be strategic about that work, and how can you have measurable, impactful grant making in a space where you have the credibility and integrity to be a change agent. Frankly, the first thing we kind of figured out is that everybody has their own definition of health equity, but there's really a pure one that comes from HHS and Robert Wood Johnson, which is that health equity is the state in which everyone has a fair and just opportunity to attain their highest level of health. And that is the vision throughout. But I have to say, it's a wonderful definition. But for me, I looked at it and I said, that seems really difficult for the Humana Foundation to solve by itself. It's big, it's lofty, and we frankly just didn't want to overwhelm ourselves and dilute our focus so that we couldn't quite figure out what we needed to do. So very early on, I figured we have to figure out how to narrow this broad term of health equity into spaces where we could figure out how can we measure impact, how can we be credible in the work that we're doing, how can we make sure that community feels like we have done something that is empowering to them. And in doing that, we also sort of said, how can we be part of the solution as opposed to just being someone who's identifying things? So we need to do research, we need to be solution focused, but we also have to make sure it has an impact on communities. And we need to find a metric to really test and measure for success. One of the things we've looked at is measuring CDC Healthy Days. But ultimately what we found is that what we can do is test and evaluate community-wide solutions on health equity issues and the social drivers of health so that we can take those learnings and better understand how systems work. We're not going to solve all of these challenges by ourselves. We're talking about systemic challenges. We're talking about generational challenges. We're talking about challenges that have a multitude of dimensions. And so we wanted to take a space where we can be impactful. And so what we're doing is we're prioritizing innovative nonprofits in geographies where our brand already exists, where people don't say, who the heck are you, Humana? And why are you here? And in the places where they don't know who we are, we're taking the time to really sit in community and understand so that we can do the work with integrity. So for us, what that means is we defined our grant making into two spaces. The first is really saying we're going to do health equity across the board, but we're going to focus on nutrition and food security. And then we're also going to focus on behavioral and mental health. Frankly, post-COVID, I think we all acknowledge that there's just a collective trauma that's happened. And we thought it was really important for us to step into this space of behavioral health and trauma, in particular, because it manifests itself differently in different communities driven by different cultures, and because there are different stigmas associated with different communities. And so we said, we're going to tackle these two areas. We're going to look at specific populations when we do this work, and we're going to be thoughtful about the work. And then we're going to be transparent about that. That's my big thing, is we tell everybody what we're focused on, and then we're honest about it, because it keeps us accountable. And then it makes community tell us you're being accountable or you're not.
Let's see. Okay, so you've just taken health equity, this big concept, you've made it something that is operational for the Humana Foundation, and you focused on two areas, so nutrition and food systems, and then behavioral and mental health. But that also leads me to a question. Even by drilling down, those are big issues and complex issues to focus on. Can you give us some examples of nonprofits that you're partnering with, communities you're working with, and what you're seeing that is, you feel like we are moving the needle here? And I say that because healthcare is a long game. We talk about this a lot in philanthropy. You may not see the change right away, but these are investments that you have to make. Let's say, take child mortality, maternal mortality, which is a big issue here in Indiana. Any of these numbers, it may not change in 1 year or even 2 years. So walk us through the kinds of nonprofit partnerships or even collaboratives that you're part of, and any exciting kind of movements you've seen. You mentioned sort of broad systems that you're working with. And so this is the School of Philanthropy, the Mays Institute. We want to understand, we want to go behind the scenes with you and really understand what are those game-changing opportunities that you are finding in this moment.
Yeah, so I think the first thing is, whenever you do this work, you have to go in community and really understand what the community views as game-changing, because what I view as game-changing may not be the same as the people who actually receive those services. So we actually spend a lot of time talking to community about what's relevant, what's needed. And we actually just launched a new website, humanafoundation.org, for anybody who wants to see it. And we talked about how we are doing our grant making. We are doing grant making in several different communities, including Florida, Texas, Louisiana, and Kentucky. And we also have a research fund. And I think to touch on sort of what we think is exciting is we are also doing a health equity innovation fund. This is where we're really doing high risk, high reward philanthropy. So we are either supporting people who are piloting something brand new or scaling something brand new. And we're really pleased that last week we announced a couple of those grants. The first one was to UNC Chapel Hill. It has created an initiative called Power Up, where they are partnering with HBCUs to support Black innovators thinking about health and healthcare solutions for communities of color. So it's got a wealth generation component within it. It's got an academic component within it. It's supporting underserved, diverse communities. It's supporting entrepreneurship, and it's also uplifting HBCUs and finding connection between those schools and sort of state traditional schools. So there's something really exciting about being able to get all of these collaboratives together. Here in Louisville, Kentucky, where I sit these days, last year we announced support of the University of Louisville Health Innovation Equity Hub, which is really a solution-based organization here in Louisville for the University of Louisville to think about how can we drive equity within our institution, but also how can we drive equity within Louisville and its community and create a hub for entrepreneurs, but for jobs, for research around health equity, and thinking about those sorts of things. In the food space, we funded support for a national organization called Food Corps, as they've sought to really come up with creative nutrition programming for young people in schools, as they've done that work in Kentucky, Texas, and Louisiana. And we're really excited because they're expanding that work. But what they're really doing is thinking like, how can we embed nutrition into school and education so that if I'm thinking about the trajectory of someone's life, I'm really starting early with school-aged kids around how I can solve for creating healthy nutrition habits, but also getting people access to culturally competent nutrition care. So we're really excited about the fact that, frankly, we hear from people on the ground day in, day out who are doing great work and looking to try things. And we are looking to say, let's give it a shot. And that is really rewarding to lift up people who have really great ideas.
Fantastic. Well, one of the ideas that I have been seeing in the field is really a willingness to take risks right now. And I hear that in some of the examples that you are sharing where innovation is part of the journey, learning, research, but also being willing to support innovators in communities that historically have not been served. So I think I'm joining you in saying there's so much going on right now that gives us reason for hope. But that also leads me to another set of challenges. For a long time, and perhaps even more recently, philanthropy has been criticized. There are a lot of advantages to the philanthropic sector. It's flexible, it's agile, it can respond perhaps in a more timely fashion than government. But there's also this question about philanthropy tends to tout its successes, but doesn't always talk about things that don't work so well. And failure is a concept that may be part of the equation, especially when you're in this high-risk environment and when you're thinking about health equity. Not all funding opportunities are going to work, and not all ideas are going to work. And there's a lot of learning even when things do not go according to plan. And I say that as someone who certainly works in the research space and grew up with a lot of my father's a pharmacologist. So I certainly understand the need to experiment and try things and find solutions that work. So tell us what you are learning around this concept of failure. Are there some opportunities that you've seen perhaps not work so well, or ideas that haven't panned out? And during the pandemic and now, how are you approaching that topic, both success and failure?
Yeah, I think almost everybody in their life needs to take at least some form of risk. And I think if we view failure as the be all end all, then we aren't really learning, right? From everything that we try, whether it succeeds or not, we learn something. We learn something about how systems work or how they don't work. And so I think what's really important is, if things don't work well, is to have a conversation about it and then be transparent about it, so we don't end up repeating the mistakes that have already been done, or we actually figure out what are the successes within that thing that ultimately didn't succeed. I think the challenge for philanthropy is a couple of fold. First of all, you can't do something for 6 months and declare that it's failed, right?
Yes.
Some of this is about giving things the time to see if they are going to succeed or fail, and building in indicators, and then allowing people to have space to fail or say, this isn't working and how can we adjust? And what that really requires is not just grant making, but partnership with grantees, right? Because they have to be comfortable enough to come to you and say, this isn't working. And for you to say, okay, well, it's not working. Let's think about this. But then also you have to be comfortable enough to say, hey, we're way far off the rails. And so some of this is about being comfortable taking risk, but it's also about being comfortable having a real conversation with your grantees and creating a safe space for them. And it's also about, we're talking about long-term issues, so you have to understand you're going to have to stay the course for a while. So some things you may not know if they are going to fail or succeed for a while, but you can build in indicators that tell you that. When I think about our philanthropy, we're a corporate foundation. And I think one of the things that I've tried to model is to really think about how we can learn from business in terms of doing our philanthropy, right? Like, if you think about it, we want to approach our work that way. So first of all, what we do is we listen to community. We go out into the community and hear what their needs are. Like, it's the same way a company would do consumer intelligence work. We want to hear from people, like, what's the problem and what do you think is the solution, right? And then we do real research, right? Our own research. We do it in collaboration with academic partners and public health experts. And then we can also do it in concert with healthcare delivery experts at Humana Inc. So we really get the landscape, right? That's the same thing a business would do. And then we look for spaces where there's either space for us to participate because no one else is participating, or where there are spaces where we can collaborate. Collaboration is really key in this work, frankly, because we're talking about problems that weren't caused by one person or one entity. They were caused systemically, generationally, and so they're going to take long-term collaborative solutions to get us where we want. And then ultimately, we measure, we test, right? Like, we have clear, measurable goals and objectives, and we hold ourselves accountable to those. And so if you're doing that, you're not failing. You're just trying things and you're driving forward and you're learning. And if something works, great. If it doesn't work, you've learned something and you can keep going. And at minimum, you've built trust and credibility with a partner who you can grow with in the long run.
Wow, I think you've covered so many topics and ideas and just concepts in this one answer. But along those same lines, around health equity in particular, we've seen many funders pivot into this work during COVID and even beyond. Funders who weren't working on health, who weren't perhaps even prepared to be in this space, but much more interest in health equity and collaboration around this. How do you approach these types of collaboratives? Because I'm sure you get calls all the time, or significant expressions of interest along the way. But one of our students actually asked, can you give us some examples of how you think about collaboration, what projects you're working on with others, understanding that solving some of these systemic issues, these health disparities that are in all of our communities, you could say, will require all of us working together. So are there some examples that you can
Yeah. So one of the grants that we did under our Innovation Fund this year was to the Community Farm Alliance of Kentucky. It was really a collaborative of a lot of different food-focused nonprofits and nutrition nonprofits across Kentucky to figure out how they could work together and whether or not their policy solutions they think are viable to address food insecurity needs in rural and urban areas. And frankly, we funded that because we could see there were a lot of different organizations thinking about the same issues, but not necessarily having a framework to work together to think about it. And so when they came together to build this, we wanted to be supportive of that. I think to the broader question of how do you make collaboration work, in particular, when you are a funder, one of the things I always acknowledge is there is a power dynamic at play. Because you're the one who has the money and an organization wants the money. And so you have to spend a lot of time stepping out of your comfort zone, building trust, being vulnerable on your side, so that what's happening is you are really creating a real space for collaboration, right? And then the other thing is, I think it's really important for all of us as funders to understand that there is probably somebody who is smarter about the work than you. Whether that is somebody who is smarter about the work because they're impacted by the services, or because they do it day in, day out, or because they have 85 degrees in it. And you should lean on those people to figure out how you can be supportive, as opposed to showing up and saying, like, I'm just going to solve all these problems. You may not know the root cause. Nobody may know the root cause, but there's got to be somebody who's been working on it longer than you have, and leaning on their expertise is extremely important if you want to drive for solutions. And then I think that the really important thing about collaboration is clearly defining roles. So I think sometimes we kind of get stuck in saying we're going to collaborate without a solution. And so everybody has to center around, like, here's where we're trying to get to. We may not necessarily know exactly what that looks like, but we're trying to solve for something. And let's all talk about what we're trying to serve for. And then I can take this spot, you can take this spot, and this is where we overlap and all of these sorts of things. And then you have ongoing conversation about it. One of the things I really want to point out here is that if you are doing work in a community that is not your own, that listening and centering yourself in community comes first, and constant and constant and constant and constant. because you may not appreciate the cultural dynamics of that community. So when you're trying to drive for change, and for example, you're talking about food and you're talking about nutrition, or you're talking about food insecurity, you have to acknowledge the cultural significance of food to certain communities. And so when you're doing the work there and telling people they should eat this or that, and not this or that, you have to understand that you may be striking at people's cultural identity. And that is not something you ever want to do, because you certainly wouldn't want it done to you. So you have to center community listening in your collaboration first. It may not mean that everybody agrees with you. You may not all get to the same solution, but if you haven't listened, you haven't collaborated.
Okay, so key takeaway: center communities, listening, and collaboration involves sharing power. Stepping
Exactly.
out of, yes, sharing power is part of it. And centering community, I think, is something that everyone is hearing more and more about, especially in the philanthropic sector. There have been so many questions that have come in since we started, and I just want to touch on a few of those questions. The very first question says, please repeat the definition from the Robert Wood Johnson Foundation. I want to make sure we do that. And then we'll get to several of the questions. I think we have time, but let's just start with repeating that definition.
Health equity is the state in which everyone has a fair and just opportunity to attain their highest level of health. That's like a mesh of the HHS and Robert Wood Johnson definition. I have to recommend, Robert Wood Johnson just did a new infographic on health equity with bicycles. I wish I had a picture of it for you now, but I really, if you're interested in equity work, you should Google that, because it is a great graphical representation of what equity means, which is, it means that not everybody gets the same thing. They get the thing that fits their specific needs. And equity work means talking about subpopulations. So you are going to have to talk about gender and race and ethnicity and disability and gender identity. And you're going to have to talk about all of those topics, because those are part of equity topics. So are urban and rural. But really strong recommendation for Robert Wood Johnson. And frankly, their graphics are, I think, the best way to explain the story to people who have not been exposed to it.
So a picture is worth 1,000 words. Check out that infographic from the Robert Wood Johnson Foundation. And I also want to bring up a question that has come up in many different permutations on the chat and at the Q&A button. And specifically what people have asked is, collaboration also involves working with government.
Yeah.
And while funders, private funders, philanthropists, donors have leaned in perhaps and embraced this concept of health equity, we've seen a lot more funding going into racial equity and justice work here at the school, both from individuals, foundations, and corporations, but not all public health departments. You mentioned urban rural. You also touched on this. Not all communities have the same approach to equity. And so some funders have found that working with their local state government, federal governments, may not always, the collaborations may not be as smooth. As we talk about health equity and center communities, how are you approaching partnerships? Or give us some examples of how you're working with, maybe it's counties or states or even at the federal level, and what are you learning? Because collaboration is costly, it takes time, and it may be the only way to really drive the kinds of change that we're looking for. So those are these questions came up in different ways. I'm just kind of trying to collate them all together. Government, philanthropy, private, public sector, how are you approaching those types of partnerships?
Yeah, so I think I touched on this in the beginning, like nobody can do any of this alone. And so we need all of the sectors if we're going to solve for the challenges we're talking about and the challenges that are systemic and generational. I think one of the first things I always think about when I do this work is the data. We actually have been able to do a pretty good job of distilling data down to zip code. Actually, you can just use census data to do it. And you can see where you can highlight specific disparities for populations within a geography. And then you can actually go and find information on the healthcare cost associated with this sort of thing happening. So if there's a high rate of diabetes, how much does this cost a community? And then say, hey, look, you've got a high rate of people in X population who are costing X amount of money. And there's a disparity here, and that disparity is costing you. So sometimes, you need to have the conversation in a way that allows people to solve for a problem that feels like something they can manage. I think sometimes when we talk about health equity really broadly, people go, I don't know which one of these to solve. There are so many, it feels impossible. So, but you have to give people things to solve. And I think data is really one of the first ways that you can really do that, right? I think the other thing to acknowledge is that underlying all of this is you find a problem, you want to solve it. How do you solve it more broadly? So it's scalability, right? Like, how do you scale a solution that's effective? Or if you find a way to collaborate and it really works, how do you scale it? Well, I think the answer is a couple of things. Market disruption is really what you're talking about. And sometimes market disruption is through policy. Policy is a great way to think about how to change the conditions around things. Sometimes it's around entrepreneurship. That's another way you can create something that didn't exist before. It's why I touched on the UNC example, because that's about funding entrepreneurs to come up with novel solutions. And sometimes technology can solve for things. It can be about collective action, or it can be about research. So one of the things I would say is the way that you drive for change involves all of these actors, but there's more than one lever to pull. So you give people something they can solve for that is in their purview, but then you also think about, are there other innovative solutions that could work that aren't just sort of what we've always done? I don't want to be naive about the fact that having conversations around health equity is difficult. I don't want to be naive about the fact that talking about dimensions of difference is difficult. But I think if you point people to a real problem, sometimes with a data-driven problem, they can all agree that they don't want that problem that is really about a data point. And you don't have to be a super sophisticated organization to do it. Like I said, like some of that's just Google, right? Google can be your friend. Maybe not the AI chatbot, maybe that'll be our friend someday. But that information is accessible. And if you tell people it, it's hard to ignore.
So let me try to recap here for all of us, because so many questions have come in about this. The key is start with the data. Data can be a powerful way of bringing people together and communicating what the problem is in a way that does align with other people's goals and objectives. And also acknowledge that this work is difficult, especially dimensions of health equity. Not everyone is going to be in agreement all the time. So be prepared for some level of perhaps you'd say give and take along the way. But it sounds like start with the objective in mind and clarify what the goals are. There, as we have been talking, more questions have been coming in.
Oh, good.
And
can I say something?
Yes, absolutely. Yes.
I think there's something important to highlight, which is that we can never ignore the value of trust in this work. So for people who came to health equity new, I love that. I think it's really exciting and really important, but it's very difficult to show up in a space where people have been doing work for a while and just say, I'm here. So you have to take the time to build trust with government. You have to take the time to build trust with nonprofits. You have to take the time to build trust with funders who've already been there. Because that's how you can get the most effective work done. I think we saw that in COVID, right? Like, frankly, some of the most innovative work in COVID came from people getting in rooms and saying, we're in a crisis. Who can do this and who can do that? Oh, wait, I can do this and this. But that required building trust first. And so if you're going to do any of this work, you have to spend the time to build relationships and trust with everybody you plan to work with.
Tiffany, I just want to stop and say thank you for your leadership, because you're not just saying this, you've actually done this. We've certainly benefited from your work on the ground, listening, building trust, learning from communities. But that is also something that I think in health equity in particular, lots of people on this webinar today want to understand, how do you actually take that and make it operational? So the idea of listening, of course, everyone can align with that, but what does that mean as a funder? Is this done through focus groups? Is this surveys? Is this one-on-one conversations? Is it listening sessions, town halls? I think around health equity, the two areas that you mentioned, food and behavioral mental health, are areas where listening is extremely important, but how you listen matters. It's not just the principle of it, but how are you sitting with others in community with others? So lots of questions around that, I think, from people who are funding in this space and want to know what are some approaches that are really effective in listening to communities and getting that feedback.
Yeah, I think the first answer is all of the above. But what I will say is what we've done as the Humana Foundation is we actually just announced the creation of what we're calling the Humana Foundation Senior Council, because we're doing work focused on seniors, veterans, and school-aged kids. We're going to have this group of 10 who will advise us on what we should be thinking about in our focus communities. It will include a population of older adults, 65 and above. It will include a population of high school students. It will include somebody who is an expert in healthcare delivery. So we are building in an infrastructure of people to test us, to push us, to say, like, are you thinking about the right things? Are you amplifying your impact in the right ways? One of the other things I like to do, this is just a sort of quiet recommendation, is I try to go to community as much as possible, but in ways that are least imposing on community and in ways where I can see the work from a day-to-day perspective. So I want to go meet with clinicians to understand, how does the healthcare delivery system work for you? I go visit clinics. I go to community events, and honestly, I sit in the back. I don't sit in the front ever unless I'm forced to. And I try to talk to people who have no idea who I am and what I do, and ask them questions about how they do the day-to-day work. And then when nonprofits who are small and probably don't fit my space at all come and talk to me, I open my door and I make time for it, because they can tell me things about the way that the community functions that I will not understand on my own. It is really, really important that you do that. And then I think one of the other things for us is we try as much as possible to have somebody who has some close connection with that community, so we have a better understanding of community identity, whether that's a person who works for us or a person who advises us or is connected in some other way. We think that form of listening is really important too, because you never completely get a place unless you actually live in it or you're of it, but we try to replicate as much as possible. I'm really clear about not ignoring power dynamics. I understand that as much as I feel like I'm Tiffany when I walk in a room and I'm normal Tiffany, a lot of people see me as Tiffany the funder. And while I don't see myself that way, I know that changes the conversation. And so I always ask people the questions differently, like, what's on your mind? How can I serve you? Like, what's keeping you up at night? And I talk to people across generations to ask them those questions. I've been doing lately listening cycles with like young leaders in Louisville, Kentucky, as I've moved here, to just say, like, what's it like here? I mean, I really lead with that. Like, what's it like here? And I think asking different questions that aren't technical grant making questions before you get to a grant making process goes a long way in actually understanding how you collaborate and how you listen. And also, frankly, making sure you're not talking to the same people over and over again.
There's so much richness in your answer, but what I would say is that if I had to summarize, is authentic engagement is part of listening. There's the data piece and being very systematic about collecting that data, but there's also the informal, less structured and authentic engagement with communities where you really engage with folks at all different levels, the grassroots, the grass tops, young people, and try to learn from people who have historically been excluded or left out of conversation. And I've seen you do it, so I know that you are speaking from lived experience. So I'm excited that the communities that you are currently serving are getting to engage with you in that way.
Can I say one more thing?
Sorry. Oh yes, please, jump in.
So the other thing I think is important is you have to mean it. Like, it cannot be a lip service exercise. You're right. I spend a lot of time engaging with community because I do not believe I am the smartest person in the room. And I do not believe that I know everything that is happening everywhere. And I do not believe that I understand the lived experience of someone who lives in a low-income community in Tampa, Florida, because I haven't lived that. And I may be able to tell you the experience of someone who's lived in a low-income community in Indiana, but that experience is from a couple decades ago. And so I know that that's not everybody's lived experience. And so I think it's really, really important that that is authentic care and listening, not an exercise you're doing to gut check your data or say, hey, I checked with the community. You have to be willing to shift things. If you're hearing from community, it doesn't make any sense. And that's how you know it's authentic.
Wow. So we hear that word a lot, but I think you've given us a deep sense of what that means on a day-to-day basis as a leader, how you show up, how you engage, how you communicate, and how you listen is really key, and acknowledge the power dynamics that are in your own situation. So lots to take away from that. I think one last area, and I hope we have time to cover this because it's a big, big area, and it's in the area of behavioral and mental health. We've touched on food and health systems and how food and health interact, but we haven't said much about healthcare and mental health care in particular. And I say that because COVID has exposed the racial and ethnic based health disparities that we have, but it's also given all of us a greater awareness of the gaps that our country has and how we serve those who need. And it seems like there are growing numbers, especially of young people that need assistance in terms of behavioral mental health, and often are current capacities. I'm on a college campus, so I hear these numbers every day that our numbers of social workers and mental health specialists are not sufficient to meet the demand. So one of the questions that came in was quite simple. Is this problem something that COVID has made worse? Was it always there? Where are we now? And how are you funding in this area? What are some innovative approaches that you're seeing success with, and where can we go from here? I think as someone who hears these numbers every day, we've seen rising rates of mental health needs, especially on college campuses, but in pretty much every age demographic, I think the numbers are showing increased need and insufficient services to meet those demands.
Yeah. So what I would say is, I think a lot of this was already here, and COVID caused us to pay attention to inequity that has existed for a while. But there are certain things that have really, I think, come to our attention or have changed because of COVID too. So I don't think it's either or. I mean, for us, when we started to think about this behavioral and mental health work, one of the reasons I got really interested into it is because there was data showing that since COVID, there's been a 47% increase in suicides among young Black men. That's new data, right? Like that tells you, and it's actually against the national trends. So there's something that is happening very specific to that community that is new. But if we think about sort of things like social isolation, which is just feeling really alone, we know that 1 in 4 seniors is really socially isolated, and 1 in 3 teens reports feeling sad or hopeless. We know these existed before COVID. COVID has given us the opportunity to really talk about those things in a way I think we weren't really able to do before because we all had a collective trauma. But we also know that COVID was time away from services for people. COVID really was a time when people were just not just lonely, you know, the impact of feeling like you're by yourself in a crowd, but also were isolated, which meant they were actually alone. And so all the data shows that certainly depression and everything else increased during COVID, and certainly that hasn't gone away. But we don't know in the long run what the trends will be and how this is going to work more long term. So for us, we've tried to think about a lot of different ways to address this, not just around sort of loneliness and isolation, but around suicide prevention and around substance use disorder, because that's an implication, right? Like if you think about mental health services, substance use disorder is something that fits into that bucket. Last year, we announced a major partnership with Volunteers of America as they thought about how to really build out an equity framework around their substance use and their sort of mental health training. But they also thought about how to expand substance use disorder programming around moms and their kids. So they have these family-focused recovery centers where moms can go through recovery and their kids can live with them, because we know that the moms are likely to do better that way. It gives you more hope for success, and you're not breaking apart a family and creating more issues with trauma there. So we've tried to think about how can we keep families together, keep people feeling connected, and make sure they don't feel lonely. And that's really hard. I think there are very few people who do what all of us on this call do, who really have been doing true behavioral and mental health work for a really long time. And I think we can all acknowledge that there is a shortage in terms of healthcare in general in this country from a labor perspective, and in particular in the space of behavioral and mental health. And then if we distill it even further, in particular, when we look at dimensions of equity, whether that's a limitation on the number of Black and Latino psychologists and psychiatrists, whether it's a limitation on the number of urban versus rural psychologists and psychiatrists, whether it's the ability of schools to provide behavioral health services because of the resources that they have in place and the finances. So the problem is real. What we're trying to do is talk to people who have been interacting with these populations that we work with for a long time to say, where are you seeing this pop up? Why do you think it's happening? And then also coming alongside them to engage in research in this space, because while we know some things about behavioral health, I don't think we know nearly enough.
There are two areas that we haven't gotten a chance. I'm just scanning the questions and I know we don't have much time. So I'm just going to mention these two things. The first one is you touched on trust. And when we link up the two areas you're working in, behavioral and mental health, trust is so important, to that work. It's so critical. And then along the same lines, food and nutrition are very personal. That also requires trust. But in this period, we've had a broad-based conversation about trust-based philanthropy, trusting your nonprofit partners to do what they need to do, to the role of unrestricted giving, and ultimately of being in partnership funders and their grantees towards solutions. So I wanted to ask you what you are doing or hearing around trust-based philanthropy, especially around health equity, because it seems like those two topics that you highlighted, trust would be critical in your work with your grantees on those.
Yeah, I think trust-based philanthropy is a great phrase. It's a new phrase. And I think it's really gotten a lot of press. I think a lot of funders are still doing, including me, a lot of the sort of bread and butter, sort of impact measurement driven philanthropy. To me, when I think about trust-based philanthropy, it's about picking partners who can be agile and understand that you're willing to focus on their agility. And what I would say is, much like any sector, I think it's great to have people who look at how can I just support an organization in its day-to-day? How can I support an organization in endowing itself? How can I support an organization in growing itself? How can I support an organization in innovating itself? Like, we need all of the above, because you need a lot of solutions to deal with really complex problems. So I'm excited about sort of the growth of this trust-based philanthropy, because it really does let organizations sort of build themselves so they can innovate. And I think it's okay for there to be funders like me who say, I want to build a relationship with you and I want to be transparent with you about what I do, and how we can work together. And I want you to know that, like, if it doesn't go perfectly, we can keep talking, right? So that is another form of embedding trust into philanthropy.
Fantastic. Well, I know we're running out of time, but I do have one last question. And if we have time, maybe others, but really, you have led through a global pandemic,
Yeah.
a racial and social justice movement around the world, not just here in the United States, and an economic crisis that, in fact, is still unfolding. We are, still in, some may say, perhaps the threat of a recession ahead. What is giving you hope at this moment? We we know you're an optimistic person. We work with you on many different levels, but as you do your work, what inspires you, fuels you, and at this moment it really gives you hope as you're doing this work, whether it's in health equity or beyond? What are those opportunities that you're thinking, wow, this is exciting, looking forward to seeing how this works out? And just share with us some of those moments that are really inspiring you right now.
Yeah. So last year, I got the opportunity to attend the Muhammad Ali Humanitarian of the Year Awards. And I thought it was a really special thing. I got to give out an award, and they honored Dr. Anthony Fauci, and they honored the World Central Kitchen, Jose Andreas's nonprofit. And I thought, I'm going to bring my kids with me. So I brought my 13-year-old and my 11-year-old. My 13-year-old had to leave for a party, so she couldn't stay. But as part of that event, each year they select 6 young adults to really celebrate who've made a difference in the world. And they had these 6 phenomenal people come up to share all of these really impactful projects they've done all across the country, world really, whether it was on issues of climate change and environmental health and resilience, whether it was on education, whether it was on all sorts of health and social justice topics. And the night itself was really special, but I had a moment at the end that gives me hope for everything, which is one of the winners was a 16-year-old who was an inventor. So she invented things to detect lead content in water and to provide early diagnosis of prescription opioid addiction and a million other things. But to me, what was most phenomenal about her is on the way out, she stopped my 11-year-old and she said, "Boy, I just have to say I'm really impressed by you because I don't know that I could have sat through such a long event when I was your age." And on the way out, my daughter said, "Mom, maybe I can be like her one day." And I thought, if I am living in a world where 16-year-olds are already changing it and then passing the legacy of changing it down to the next generation, then we're going to be okay. So I know there are people day in, day out working on all of these things. And I know that their message is emitting to people everywhere else. And so if you know that, then you know ultimately that there's a ton of hope in this world because people are what really drives it all.
Wonderful. Well, I love your message. There's an abundance of hope. There's so many young people and people of all different backgrounds that are working every day to make a difference. We feel very fortunate here at the Lilly Family School and the Mays Institute to work with so many of those change makers. And I'm also so grateful that we have you as a shining leader in this field to help support all of those change makers and innovators. So thank you again. And I'd like to also take this opportunity to thank all of you who've joined and my colleagues, LaKoya Gardner and Molly Grimm, who helped organize. LaKoya, I don't know if you can come on and just say a few words before we have to end the webinar. It's been such a fun experience. We almost want to keep the conversation going.
Absolutely. Tiffany, thank you so much for joining the Mays Family Institute on Diverse Philanthropy. What a dynamic conversation. I'm so glad that we were able to engage in health equity and certainly look forward to our engagement in the near future. So thank you again so much for joining us.
Thank you.
Thank you all, and we look forward to seeing you at our next events. And Tiffany, we hope to see you in person at some point at the school. Thank you again for your leadership and all the best in your new role at the Humana Foundation.